Hi, everybody. My name is Keely Spring. I'm a licensed marriage and family therapist in the state of California. And today I have with me Christina Stein. And Christina, I'll turn it over to you in just a second. But what I like to do at the beginning is just kind of tell people how I know each other, how I know the other clinician. And you and I did the math. We've known each other for 27 years.
Oh my gosh.
I know.
Wow. Hey,
Right? A long time.
together. Yeah, for sure.
So we actually met undergraduate USC. We moved into the dorms a couple doors down from each other. Been
Yep,
friends ever since.
that's true.
So without further ado, Christina, I will turn it over to you to ex kind of explain your niche, what you do, who you work with, and go from there.
Okay. Well, let's see. My niche. I started out as a marriage and family therapist doing kind of general therapy. And then I became a mother and realized there was this whole world of sexuality and relationships that wasn't dealt with or talked about enough. And so I went back to school and got a PhD in human sexuality. And ever since then, I have focused on intimacy and relationships. And I would say most of the people I work with a lot of women who are sort of navigating life transitions. So it sort of started out with like new moms or pregnant moms or just kind of that transition from being like one person and then having a little one with you all the time. And also now a lot more around like the later transition for women around like perimenopause, menopause, sort of just navigating those identity shifts. Um, for individuals, but also for couples, like how does it change your sexual intimacy with your partner? I do a lot of desire discrepancy with couples where one person wants to have sex more frequently than the other. And so I help them figure out a compromise and, how to have enjoyable sex so that both people are looking forward to it and it's a positive experience, both physically and emotionally. Um, and then the other niche that I focus on is I do a lot of erectile dysfunction with men. I happen to, I worked with a lot of men, and I think I have a sweet spot for that struggle and just kind of being able to help them figure their way through it.
Mhm. So yes, this is one of the things, Christina, you've been asking the uncomfortable questions about sex and things since I met you.
Again, nothing was off limits.
No, but in such a great way. It is such a, I haven't had anybody on this that has that niche. I think it's it is a very needed niche, but it's one of those kind of taboo topics people don't feel comfortable always kind of diving into when it's such a huge
Yeah.
component of who we are and what we do with life, and it is so
Oh, yeah,
important.
totally. Totally.
And Christina, just because I know you so well, I know that you have an entire empire of other offerings and things like that that you do. Would you mind sharing some of the other work that you do as well?
Oh yeah, definitely. So I've been in the personal and professional development space for probably as long as I've been in private practice. I've sort of simultaneously had this passion for psychology when it comes to like, psychotherapy and emotions, but also empowering people, goal setting, time management. I have co-authored 4 books. I'm currently writing a fifth. It's called The Accomplished Woman, 12 Ways to Redefine Success and Live Life on Your Terms. And I also teach people how to speak and present. So I do a training called the Speakers Academy with my father, who actually is a professional speaker. And from that, I've become really passionate and excited to help people really develop their own brand, develop their own business and launch themselves. Even therapists, I have worked with a lot of therapists. I've worked with a lot of like mindfulness coaches, breath work people in the mind body healing space need kind of that like structured direction. And it's been really fun kind of helping them claim more, just get their brands out there, get their offerings out there so they can help more people.
Mhm. Mhm. Yeah. Yeah. And you do, you were saying speaking, you've done speaking all over the world and
Yep.
Yeah. You're
Yeah,
very awesome. I
I
love it. I love all the stuff that you're doing. It's so good. It's so great.
thank you. Thank you. It's a lot of fun. Keeps me busy.
Yes. Yes, you're one of the more busy people I've ever met.
I get that a lot, actually.
You're good at juggling a lot of
I'm, yeah, I think juggling is one of my skills for sure. And I teach people how to juggle, so I think
for
that's a
sure.
thing we learn.
Yes, for sure. Okay,
Yeah.
so what was your journey to becoming a therapist? How did you decide to become a therapist?
Um, well, I'll give you like snapshots because it's probably a long story. As a kid, I had stomach aches because I worried a lot. I felt responsible for a lot of people, and I was always convinced that the stomach aches were not physical, they were emotional. But the people around me that didn't make sense. So from a young age, I wanted to be like a mind-body doctor. And so when I went to college, I majored in psychology and pre-med. But I quickly realized that pre-med was super competitive and I really wanted to be a mom and I wanted to have a home life. And I kind of decided that I would drop the pre-med and I would keep the psychology because that gave me a little more autonomy and I could control my time. At the same time that I kind of was pursuing psychology, I had panic attacks in college and ended up seeing my own therapist and had this experience of like psychotherapy and having a new language to what I was experiencing and how I could express myself and feeling validated. And it was so powerful for me that I think that turned my psychology route into like the becoming a therapist route because it was like, I have to do this for people. This is great. Um, and so I did. I got my undergraduate degree in psychology, and then I got my master's in clinical psychology, started a private practice, and then, like I mentioned, I have three children. So when my first child was born, I had this another pivot of like, oh God, what is this thing? Like it's like the fine print of motherhood that nobody tells you about, and that kind of inspired me to really work with couples and women and help relationships stay together, not fall apart when they had children. Um, yeah, and that's kind of been my journey. I've always been very I'd say like I guess the technical term is like psychoeducation. Like I want to empower people with actionable skills as well as honor the feelings that people kind of have to go through to take those actions.
Yeah. And what would you say that you like about therapy?
What do I like about therapy? That's a good question. I think when I first started my training, one of the things I noticed and I used to say is that like there's something magical about therapy. There's something magical about like connecting with somebody like verbally. Like I sit with clients and I hear what they're saying, but I think on some level I'm like very intuitive. And so I connect to how they're feeling and what they're saying. And like there's this place of kind of knowing and it's safe and then we can explore what's really happening and then the shifts that occur, like when somebody realizes that they have the power to make a change or that like the way they've been seeing something is affecting how they feel. And when they shift how they see it, suddenly it's like they feel liberated and their whole life changes. It's such a gift to witness that, I think, as a therapist.
Mhm. Mhm. Yeah, I would agree. Okay, what are some of your favorite modalities? You have this very interesting niche. What are the kind of tools
Okay.
that you use or modalities, techniques you use?
Um, well, because it's sexuality, and I said like I do a lot of, I'm really big on pleasure. So I work with pathology, right? Like the struggles that people have in their sexual relationships. But I also want them to have a positive experience. So I would say I'm sex positive. I bring a lot of props and tools. I've created workbooks for couples. So I have a pleasure series that I give to a lot of couples where it kind of they can take it home and they can look through sort of the process of desire and arousal, and then there's actual techniques to try and ways to communicate about it. So I would say I incorporate a lot of tools into my practice. Um, and then I guess more traditionally, like I'm psychodynamic. humanistic, a little bit of Gestalt. I'm definitely a mixed bag when it comes to my modalities.
Gestalt hasn't actually come up before. Can you explain just a little bit of what that is?
It for me, it's like really kind of tracking what's happening in the moment. So like when I say something and somebody shifts or their eyes move or they breathe differently or their voice changes, um, going with what that is, like bringing that into the room so that it's part of, it's kind of like, it's almost like holding people accountable for their experience in the moment. Yeah,
That classic chair, right? Whenever you're like learning about it, don't they do the like the chair, like
the chair, yeah.
the person was here and sitting in this chair, what would you? Yeah,
Yes.
very
Yeah,
much present
totally.
moment.
Present moment, like what would you say and how does it feel to say that right now in this moment? Yeah.
Okay, so what does a typical session look like?
Typical session. Well, let's see. I don't know if you can see behind me. I have this lovely, I'm still virtual. It actually with the pandemic kind of it was great because I had all these couples that I was working with and they were, calling in while sitting in their bed. So here we're talking about sex and intimacy and they're in the most perfect context. And just ever since COVID, people have still really appreciated, I think, the convenience of virtual therapy. And so I have been fortunate enough to be able to stay in that space and still have, a lot of clients who are happy with that. So a typical session, I guess, is 50 minutes and it's via Zoom. Um, and really it's kind of, I let the clients decide where we're going. Sometimes they know where they want to go and something's come up and we're really kind of focusing on a specific thing. Sometimes we're continuing kind of something we've been working on from the previous session. And sometimes it's a combination of the two. So I do also have clients who come to me who where we have goals that we're trying to achieve in therapy. So especially if it's around like sex and intimacy, there will be like homework from the previous week and I'll check in on the homework. We'll figure out like how it went, why it didn't work, what we can add for the future. And then we kind of break that down. So sometimes it's very practical and sometimes it's much more fluid.
Yeah. Yeah. It sounds just organic though. You're kind of following wherever people want
Yeah.
to go. I think it'd be hard to have an agenda when you're dealing with your niche, right? You having an idea of where you wanted everybody to stand.
Totally. Totally.
Okay. Is there anything that still surprises you about therapy?
Yeah, like therapy in general or my particular sessions. I mean,
Both.
um, I think I learn something new every session. So, like even though I've, read and studied and practiced and taught around like intimacy and sexuality, I still learn new things. I learn about like new experiences people are having or new fantasies they have, or it's like I'm growing constantly and kind of love the surprise of that, like to get to be on that journey with people and learn kind of what is so individual to each person. There's no blanket, this is the right way of doing things. It's just like there are so many different ways of doing things. So,
Love it. Okay. Is there something that you wish people knew about therapy?
yeah, actually, I feel like the most frustrating thing for me as a therapist in whatever space I'm in is that like people don't tend to come to therapy unless they're having a lot of distress, right? It's like people have to be in pain, couples have to be fighting or not having sex or frustrated. Like it's usually a result of, okay, we have a problem, let's solve the problem. And I think that therapy is really a gift, right? It's a gift to kind of like get to know yourself and gain greater self-awareness, whether you're doing it individually or as a couple. And when you have a better sense of yourself, I think you're more engaged in life. I think life is more fulfilling. You make more meaningful choices. You're more proactive on a daily basis because you're actually coming from like an aware place. I think when people are not aware and they haven't done work on themselves, they just sort of are reactive to what other people ask of them. And, they're more passive. And I think when you're more passive in life, you feel disempowered, frustrated, depressed. It's not as much fun. There's so much potential for fun and having a great life. And I think it really starts with like you making choices for yourself.
Hmm. Hmm. So to that end, you mentioned earlier props and toys and all those kinds of fun things. Uh, what's a tool or something that you could share with the audience that is good for kind of, sexual intimacy or, I don't know. I'm not in your space, so I don't know which kind of tools might be appropriate, but is there something that we could share with the audience that
Oh,
is useful?
well, one of my favorite things to recommend is, a lot of the issues people have around intimacy is they're self-conscious, right? Like you really, in order to feel arousal, desire, pleasure, you have to be relaxed to some degree. And most of us are really stressed out. We're distracted. We're in our heads. And that happens a lot in the bedroom. People come into the bedroom, they want connect with their partners, but they're like, oh God, I've got this to do. I forgot to do that. I've got these 8 things on my to do. It's like hard to be present and physically relaxed enough to be receptive to a positive experience. So one of the things I love to recommend is having couples wear masks, like a sleep mask, because it cancels out your ability to evaluate with your eyes. So you're not assessing, right? You're not looking at the clock to see what time it is. You're not watching your partner's response. You're not noticing like the crease on your leg that you're self-conscious about. You just kind of get to be in the sensations of your body. And it really kind of transforms the experience for people. And it's so easy. And, you can take it through an airport and not worry that they're going to take it out of your bag. Um, so that's usually one of the first things I recommend people experiment with is wearing a mask so that they can, kind of be in their bodies more.
Hmm. Hmm. Yeah, love it. It's super accessible. Will you just speak to, because I know you also have a YouTube channel and you share tools and kind of, respond to questions that people ask and that kind of stuff that's accessible.
Yeah. So a colleague of mine, her name's Dr. Suzanne Pelka, and I have this YouTube channel called Dear Sex Doctors. And so we decided, like, let's just start posting brief videos addressing like issues that our clients have, and, give tools and ideas for people. So yeah, it's called Dear Sex Doctors. And yeah, I think it's super fun and it's been helpful. We got a lot of comments. So thanks. Yeah.
Yeah, I've definitely pointed people in that direction. I'm like, I don't know, but
This could be helpful. Yeah, for sure.
all right. Okay, so you ready for the slightly more personal, still high level, but personal questions? Okay. All right. What is something that is making you happy right now?
Something that's making me happy right now. Well, we're planning a family trip, my husband and my 3 kids, and it's been really fun kind of getting the kids' feedback on it. I love to travel. I think that if I could just travel all the time, that would be fabulous for me. So it's been really exciting to see as my kids have gotten older that they are also excited to travel and that they have the resilience to travel and they're curious. So we've been doing a lot of planning lately for that travel.
Where are you all headed?
We're going to Europe.
Nice. Nice.
So yeah, yeah, I think it's great. And my oldest is graduating, so it's kind of a really nice, I know it's crazy. It's a really nice thing that we get to do this before she goes off to college and, starts that next chapter.
Yeah. Okay, what's your favorite app?
Favorite app? Oh
Yeah.
God.
Doesn't have to be clinical.
Probably Amazon. Um, Yeah, I mean, gosh, my favorite, yeah, I'd have to say like I use Amazon a lot. What other apps do I use? How about this? Here's a recent app that I used. It's called Vester, Vester. And I used this app because I was traveling and my dog got an ear infection and I needed to get medicine for his ear. but it was a Sunday and I couldn't get it from our vet and I was not at home. And so this really great. There's this, so you basically sign up, it's $120 for the year, and you get 4 virtual visits with a vet. And I literally signed up. I booked us an appointment. I saw a vet that day for 30 minutes. I like showed him the dog and pictures. It was like a real appointment. And he called in a prescription and I was able to treat my dog. So, or, if you have a pet, it kind of hijacks everything if they get sick or injured. And, it's way less expensive than having to go to a local pet hospital. So yeah, that was great. That was a good find.
Yeah, that's a huge find for sure. Sure, yeah. Sure others can use that one,
Oh yeah,
for sure. I might download that one. Okay. Beach or mountains? I think I know you'll answer, but
beach. Yep, for sure. I'm not a fan of the cold. I do love nature. I love it to be green, but I don't like to be cold.
mhm. Yes. And you do live close to a beach as well, so makes
Yeah.
sense.
Comforts.
For sure, for sure. Okay, what is one thing movies never get right? Can be about anything.
That's one thing movies. Well, I guess I could link it to my field and say that the sex scenes in movies are never right. I think we all crave that primal hunger, passion that you see in movies. And maybe that happens for some people in the very beginning when they first meet someone else and there's like anticipation and buildup. But I think that what's depicted in movies around sexual interactions and pleasure and passion sets a very high bar, especially for couples in long-term relationships who like that initial lusty phase really passes quickly and it becomes a much more connected, attached, comfortable type of sex. So they're always trying to get back to this firework thing that is really hard to recreate and very unrealistic. So I'd say that's what they don't get right.
Sure. You have a variation on what most clinicians have said, which is some therapy related, some sort of relationship related thing that movies never get right, right?
Totally.
Okay, what's the best way to relax?
For me,
Yeah.
or I love heat. Like I want to relax, I love to take a bath or like I love to go in a sauna. Like to me, just like the heat, I think relaxes my nervous system and just lets me kind of chill and it feels good. Might be because I'm aging and my body hurts more and I need more heat. I don't know. But yeah, I would say heat, like a jacuzzi, a bath, a sauna. That's kind of my go-to when I'm looking to relax.
Yeah. Struggle is real as we get older here, for sure.
Yeah, super fun.
Okay, dream trip location. I know you're an avid traveler. Is there anywhere that you haven't been that you're like, really, really want to go?
I would really like to go to Morocco.
Oh, all right.
I've heard of these like trips that people take where you can like, I mean, I'm sure this is like a fancy luxury thing, but like you go out on like camels and they take you into the desert and they set up these really comfortable camping sites that you get to like really have this experience. And so that's something I've been really curious to do.
Mhm. Nice. Yeah. Yeah, I've heard about similar things, but more in like Africa for safaris, all right. It sounds kind of like a different version of, you
Yeah,
know,
like
kind
a
of
desert,
a camel rather than a,
an elephant
yeah,
or
whatever.
totally.
Okay, what advice would you give your younger self?
Ooh, that's a good question. Advice. How young is myself that I'm talking to?
I was thinking more, high school, junior high, younger.
Um, okay, let's see. What advice would I give to my younger self? Um, I feel like when I was younger, I worried a lot more than I needed to. I felt a lot of responsibility, and I think I because I felt so much responsibility, I didn't allow myself to be as playful at times. So maybe I would have told myself to like let loose a little bit or not worry so much that things pass and let like people survive if I'm not helping them or, those kind of things.
That's interesting because you're actually one of the more playful people I think I know in my life, friend-wise. I think you have cultivated a lot of play. Like whenever we hang out, and I feel like there's a lot of
Yeah,
laughter, play.
I
Hang
would completely agree. I think maybe my younger self gave my older self the advice that I'm giving my younger my younger self, so I kind of switched. No, actually, I think, kind of like tying it all together. I think um going to school for psychology and becoming a therapist helped me like let go of a lot of those like narratives that I had about being responsible and like not being able to let loose. And I think kind of feeling more authentic as a person really helps me embrace, like I really believe that like every day should be meaningful and I try to make every day meaningful. Like when I'm making choices, I'm like consciously making choices and I'm making them because it's like, well, what matters the most right now? Like, do I want to do this? And am I doing this for the right reason? Or am I doing this because I should or I have to? And I really think I live consciously so that I can have fun and be playful and have it be something I feel excited about, I guess.
on. Would you say that the kids helped with that too? Having kids, that playfulness?
Yes, for sure. Yeah, having kids is great. It's like you get to be a kid again in like their experience and like, I'm a huge fan of Disney, so I got to like relive Disney with each of my kids, which was fantastic. Um, yeah, it's been really good. Kids have been great.
Yeah. I think it's great that you say this, but that's one of the things like when we were in college, we used to go to Disneyland for when we were stressed.
Remember, we'd finish our finals and then that was like our celebratory thing was like, yes, okay.
Yeah, and we're still doing that.
It's a lifelong tradition. My poor kids are like, Mom, we can't go to Disneyland again. It's fun. Let's go where the roller coasters.
Meanwhile, you and I are like, conference near Disneyland?
Oh, great, fun. We're there.
Hmm.
Oh yeah.
Okay. Out of the four seasons, which one's your favorite?
It's my favorite season. I'm gonna say probably summer
Mhm.
because I think for me, like I love to be active. And I love like so when it's warm, I feel more inspired to be active. Same with vacations. Like if I go somewhere where it's warm, I feel like I go running, I go outside. I like to be outside.
For sure. Yeah. Okay. What is the worst superhero power to have?
What here? Let's see. Well, I mean, I've seen a lot of superhero movies because I happen to be a big action fan. Um, I'm gonna say, well, in the X-Men, the girl who like burns people with her hands,
Oh, yeah,
that's a
that'd be
pretty,
rough.
I mean, if you couldn't, that to me, okay, yes, that would be the worst thing. If I couldn't touch people, then that would suck. Like if I was gonna touch somebody and it would harm them, that would be torture because I am physically affectionate and need that. I'm a big touch person.
Yeah, great answer. Love it. Most clinicians so far have said mind reading. So love
Oh,
that you had a different, totally different, because I agree with you. Touching somebody, if you couldn't touch people, like that would be awful. That'd be horrible.
lonely. Yeah, no, that would be really hard for me.
Yeah,
Yeah.
I'm with you.
I don't even know what it is. Like, I guess she can like, I don't know. She melts things with her hand. I don't know.
Yeah, how is that even a superpower? Right? I guess
Yeah.
yeah, if you're camping, you need a fire or something. Like I got you.
Yeah, totally. Melt the ice cubes.
It's something. Okay, what's an animal that resonates for you?
Well, I think I'm connected to two different animals. I really like the lioness. I feel like like she takes care of her cubs and she hunts and she's pretty tough and a badass. So I like the lioness, and I'm also very connected to owls. And I was connected to them for a while, and then I learned about how like one of the cool things about owls is they can see in the dark. And I think part of that for me is like being able to like see people and read them and understand them and kind of like know what's going on behind the obvious. So I like that a lot.
Love it. Love it.
Cool.
Okay. Final answer. Final question. All
Okay.
right. When you look back at your life, what do you hope you'll be able to say?
Hmm. Hope I'll people will say, or I'll be able to say.
You'll be able to say. Like if you look back at your life, what do you hope, the reflection would say?
I have no regrets that I lived every day, that I enjoyed every relationship, that I made meaning out of all of my experiences, that I helped people. Just, I think I don't want to regret anything. So I'll really live a life to like prevent that in the future.
Love it. Well, thank you, Christina. You are now officially seen.
Thank you very much. Excellent.
For
Yeah.
anybody watching, I'll add your information below and some of the things that we talked about there so that they can find you. Is there anything else you'd like to say before we kind of hop off here?
Um, no, I think it's great that you're doing this and it's fun to be on your podcast. And so thank you for having me.
Of
And
course.
yeah, I'm excited. It's great.
My pleasure. My pleasure. All right. Thanks again.